Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on the topic of migraine. Migraine is one of the commonest disease mostly among women. It affects women 2 to 3 times more than men. The ratio is 2 to 3 times. Basically, this is a disease of nervous system. We call them as primary headaches. There is no other reason. This is not secondary to any other disease. This is primary headache by itself. These occurs in episodes and these will be mostly recurring. There is nothing life threatening about this disease, but it will hamper your day to day activities, it will hamper your job, it will hamper your work life balance, especially if you are a household woman. There will be difficulties in household activities, and also most of the people cannot enjoy their leisure time or vacation because of this disease. You will have complete information about migraine. It will be the latest information, and it will give insights into homeopathic treatment, and you can completely get rid of this migraine once you watch that video and come to us for treatment. Coming to the symptoms and signs of migraine, it is very important for you to understand so that you can recognize this as early as possible. There are four phases in this disease. First phase is prodrome, second phase is aura phase, third phase is proper pain or headache phase, and fourth phase is postdromal phase. So we will understand phase by phase in a sequence. Most of the people will have all the phases, but some of the people will not have aura phase. Other than aura phase, other phases are present in some of the people. Coming to the prodromal phase, this is the first phase of the headache. It occurs around 2 hours to 2 days before the actual headache. So in this phase, the patient's mood is altered. They may become more irritable, they are at a depressed state, they may be euphoric or elated phase, they may feel weakness or fatigue, they may crave for some of the foods, especially their neck muscles are stiff, they may have constipation or they may have loose motions. And the important thing here to recognize is they are sensitive to light, they are sensitive to any smell, strong smell, or they are sensitive to noise. It means they are not able to tolerate a small amount of light or light amount of smell or any small amount of noise. They are not able to tolerate, so they become irritable with this smell, noise, and light. After prodrome, next comes the aura phase. This is a special phase which is only seen in migraines. What happens here is there will be weird sensations, visual sensation, auditory sensation, gustatory sensation. There will be different types of sensation. We will look into it. First one, this happens 5 to 60 minutes before the start of the headache. See, they can be flickering in front of the eyes. There can be zigzag lines. These lines may be black and white or in color. There will be a central blurred vision part where but the periphery is okay, and there will be loss of certain part of the vision. So when you see something, certain part of the visual field is lost, and there can be delusions means you can see some things which are not actually in front of your eyes. Next, coming to auditory hallucinations, so you can hear the voice which is not there in the surrounding. And also your skin becomes sensitive, your shirt becomes painful, it may irritate the body, and also you can feel itching, tingling sensation around the skin. The third phase is pain phase. This is the actually where you feel headache. This headache is always associated with either nausea, means there will not be any vomiting, you will feel the sensation of vomiting, sometimes there will be vomiting. Photophobia means you are afraid of light, you are not able to tolerate a very minimum of amount of light, you would like to sit in a dark room, and you are also not able to tolerate any sounds, any small sounds you are not able to tolerate. The headache will be normally throbbing or pulsating type of headache. This headache, the location is very important. This can happen on one side or either left side or both side, or right side, or it can happen on both side or any part of the head or face. It may happen on the neck, it may happen on the back of the head, or the headache can be settled down on any of the eye or both of the eyes. So there is no particular pattern, but it can happen within all these patterns. Yeah, the next phase or fourth phase is post-dromal phase. This is the final phase of the headache. Normally, what happens here is the pain is relieved. You feel depressed or exhausted or completely out of energy in this field, and you would like to lay down for the rest of the day.